Afternoon. My name is Catherine Alexander Anderson, and I'm a licensed acupuncturist and a board-certified reproductive acupuncturist. Currently, I practice here in Kennebunk, Maine, also in Portsmouth, New Hampshire. I have a practice called Rhythms Center for Women's Health, and we primarily treat men and women trying to conceive. So today, I'm going to talk to you about enhancing your fertility naturally with Chinese medicine. So the first question everybody always wants to know, or I feel compelled to answer, is what is Chinese medicine? Chinese medicine is thousands of years old. There's always some debate about whether it's 2,000, 3,000, 5,000. Does it really matter? It's thousands of years old. Some written text in Chinese medicine date all the way back to 168 AD. In this country, however, Chinese medicine was really only introduced back in the 70s. And how that came about is President Nixon traveled to China, and with him he brought a reporter from the, I believe it was the New York Times, and his name was James Reston. And while in China, James Reston came down with appendicitis. And post-surgery, he was treated with acupuncture and had such amazing results that he felt compelled to write about it in the paper when he returned. And at that point then, acupuncture just started to really explode in the United States. And some practitioners started practicing even though they were trained in China. And one woman in California was jailed actually for practicing acupuncture before it was legalized. President Reagan had made the practice illegal. So I think it was in '76 that it actually became legalized in the United States. In this country, though, we always think about Chinese medicine, we think of acupuncture as the primary modality. But really, Chinese medicine is about 4 modalities: acupuncture, Chinese herbal medicine, nutrition, and what I call restorative therapy, things like yoga, qigong, and meditation. And Chinese medicine theory really is based on the concepts of yin and yang, these opposing forces in nature. And all life is considered a balance of these forces. And we use these 4 modalities in Chinese medicine, the acupuncture, herbs, nutrition, and restorative therapy, to help balance those forces within our body. So one question I'm often asked is, what kind of training do acupuncturists have to go through? And I've had people say to me in the past, well, interesting, well, what is that, like a weekend course? Which is really kind of funny to me, because Chinese medical school is similar to Western medical school. The training is a 4-year medical degree, and we do clinical rotations. The first 2 years of our training is pretty much book work. We may do some assistantship hours in clinics. And the last 2 years, while we're still doing some book studies, we'll also start to do some clinical rotations, hospitals, healthcare settings, and whatnot. We have about 3,000 hours of training in Chinese medicine. We have to be state licensed. Most states you would be called a licensed acupuncturist. If you do another 1 to 2 year training post the 4 years, some states will recognize a doctor in acupuncture and oriental medicine. Some states with just the 4-year degree, Florida is one of them, recognize you as a doctor of acupuncture and oriental medicine. We do have to be nationally board certified. We have rigorous exams to pass. And in some states, medical doctors or chiropractors are allowed to practice acupuncture with some additional training, typically 100 to 200 hours. But what's interesting is that even with their training, we still, compared to our training, we have about 3,000 hours in training hours. So beyond that, if you're a licensed acupuncturist, you can get specialty certification to practice infertility, treating infertility cases. There's an organization called the American Board of Oriental Reproductive Medicine, and acupuncturists have to have been practicing for at least 2 years before they can be qualified for this additional training. And you have to pass a rigorous certification exam, and you would be provided advanced training in Western reproductive endocrinology and infertility, and advanced training in Chinese medicine, gynecology, reproduction, and infertility. So we're also up to date on the latest research, and our organization is doing a lot of research outlining the benefits of using Chinese medicine and acupuncture to treat infertility. So the World Health Organization has listed hundreds, I should say maybe dozens of conditions that acupuncture is good at treating, everything from addictions to anxiety, arthritis, the common cold, depression, fertility, obviously, irritable bowel syndrome, menopausal symptoms, pain is a huge condition, menstrual problems, a big specialty area of mine, as well as sleep disturbances and stress. I mean, literally dozens and dozens of conditions that have been shown to respond positively to acupuncture. So in terms of Chinese medicine and infertility research, the first gynecology book in Chinese medicine dates back to 1237 AD. So again, quite old. And in this country, there are some famous landmark studies. There was a Steiner-Victorin study in 1996, and that was showing the effect of increasing blood flow to the reproductive area. And then in 2002, there's a famous study by Paulus, and he basically has shown higher clinical pregnancy rates in an acupuncture group versus a control group. And again, acupuncture in terms of fertility really took off in this country in 2002 with the published research that Paulus did. Some other studies on the heel of that in 2008 talk about some conclusions in terms of acupuncture increasing the odds of conception. Some famous studies show that using acupuncture in conjunction with IVF, which is in vitro fertilization, it's an advanced reproductive technique that's often used if somebody can't conceive on their own. That research has shown that doing acupuncture in conjunction with this in vitro fertilization can increase someone's chances of success of conceiving by upwards of 60%. So really huge there. And again, as I stated, the American Board of Oriental Reproductive Medicine, as practitioners, we are constantly doing new research to try and show evidence of how acupuncture can help someone conceive a child. So, in Chinese medicine, how do we diagnose? It's certainly different than how we diagnose in Western medicine. We diagnose based on patterns, pretty much. So it doesn't so much matter to us that somebody presents with arthritis or diabetes or infertility. We look at all the signs and the symptoms, and we gather all of that information. We look at the person. Our 4 methods that we really look at is observation. So we look at the person's makeup, we look at their skin color, their hair. We listen, we see if there's any sounds or smells that may be unusual. We palpate, we may palpate the abdomen, the pulse. We feel the pulse in 18 different positions. So we don't just feel the pulse in terms of the rate of the pulse in Western medicine. The pulse indicates different states of organ balance or imbalance. And there are different qualities of the pulse which help to identify what's going on internally. We also inquire. This is where we ask a bunch of questions. We ask questions about every bodily system from head to toe. And again, then we take all of those symptoms, we put them all into a big funnel, and they funnel out into different patterns. And it's those patterns in which we treat in Chinese medicine. We have a saying in Chinese medicine. It's called one disease, many patterns, one pattern, many diseases. And again, somebody could present to me with, let's just say, diabetes. And how we treat that diabetes could be with multiple patterns. And if I have 5 people here all with diabetes, they may all get different acupuncture points, and they may all get different herbal prescriptions. And that's the beauty of Chinese medicine. The medicine is very customized and individualized. So in terms of general treatment progression, people always ask me, how long would I need to come for treatment? So treatment really is about whether a problem is acute or chronic. In general, acupuncture has a cumulative effect. So if we could cure a long-term issue in one visit, that would be amazing. But typically it may take a series of visits to address a problem. And on average, we say, 3 to 6 weekly treatments in a row. Then the treatments may be spaced out every other week, once a month, or quarterly or whatnot thereafter. When it comes to treating infertility in Chinese medicine, we typically treat weekly. And oftentimes we will use a combination of acupuncture and herbal medicine as well. In addition, there's some dietary information and some changes that we'll discuss as well that are good for fertility. So everybody wants to know, of course, especially in Western medicine, they want to know how acupuncture works. And there's some proposed physiological mechanisms for acupuncture. It addresses 3 systems, essentially: the sympathetic nervous system, the endocrine system, and the neuroendocrine system. And again, many studies have shown exactly how they're affecting these systems. I'll outline some interesting points in a minute. I like to do that by comparing how acupuncture works in the Chinese medical viewpoint versus the Western medical viewpoint. As I discussed, in the Chinese medicine model, acupuncture works by looking at these yin and yang opposing forces. And there's what we call energy or qi that runs through meridians that flow throughout the entire body. Acupuncture points then fall on these meridians. We insert needles into these acupuncture points on certain meridians to affect certain conditions and symptoms that people may have. The stimulation of these acupuncture points helps to unblock and get things moving along the system to create that balance we talked about. But I never really talk about that with my patients because it seems sort of a nebulous concept to try and understand. So when I'm talking most often to patients and to Western medical providers, I talk to them in terms of what the research has shown. So the research basically has shown that acupuncture stimulates the central nervous system. And by inserting needles onto meridians and into certain acupuncture points, everything is stimulated. The electromagnetic signals in the body are stimulated. We're releasing neurotransmitters, activating hormones. We can activate the pain response and the inflammation response. Some great research is being done. There's a gentleman at Mass General Hospital in Boston, Massachusetts, doing some research using MRI, magnetic resonance imaging, to study the brain's response during an acupuncture treatment. And what he has found is that the brain is responding similar to a brain at rest. And what he has said is, so this doesn't really show me how acupuncture works, but it's showing that physiologically there's a response happening in the body, and the brain is responding similar to a brain at rest during a REM sleep state. And basically, during a REM sleep state, every cell in our body is regenerating. And every time I talk about that and tell people how that works in those terms, I get goosebumps, because it really is showing that something is happening in the body at a physiological level. So with herbal medicine, again, we'll use herbal medicine. There are hundreds of herbs to use, and we combine those herbs in different ways depending on what someone's pattern is. And herbal medicine is usually safe and when it's prescribed properly. So again, in my clinic, how I treat fertility is I use a variety of methods. I use acupuncture, I use herbs. I have women use their basal body temperature charting to help me diagnose what sort of patterns they have. There are different tools that we use. So in addition to the needles, which aren't really needles at all, they're sort of, we call them stainless steel filaments. They're about the size of a strand of hair, so very, very tiny, usually painless. You might feel a little prickle of a needle go in, but nothing, it's more the fear of what you're going to feel more than what you may actually feel at all. We use other tools like cupping and gua sha to help us diagnose also. So there are many fertility conditions we can treat, from polycystic ovarian syndrome to male factor infertility to recurrent miscarriage to advanced maternal age. So basically, just to sort of wrap up, in terms of Chinese medicine. There are many ways that we can help to treat fertility beyond the typical Western medical protocol. And using Chinese medicine with acupuncture and herbs, we have really high success rates. Research is constantly being done. And if you have more information about trying to find a licensed acupuncturist who specializes in treating infertility, I would suggest going to the American Board of Oriental Reproductive Medicine's website, and you can get some more information. So I thank you very much today, and we'll see you next time.